Hi, I'm Ben Wheely, and welcome to today's edition of The American Way. While we are concerned about our patients' dignity and their civil liberties, the restraint policy is there to keep you safe. A few of our colleagues have been injured recently on these types of calls, which causes us to take a step back and look at a 360-degree view of the problem and come up with solutions going forward. Every patient on a 5150 hold will be restrained with a minimum of 2-point restraints. When you get on scene of a call, as with any scene size up, you're going to evaluate the needs of the patient. If the patient is willing to be restrained and responsive to your directions, you can go ahead and use 2-point restraints. If the patient displays any sort of aggression, expresses unwillingness to be restrained, or has any verbal outbursts, you need to strongly consider the use of 4-point restraints. When you're restraining a patient, you need to do your best to minimize any and all movement of that patient. And that means applying the restraint to bare skin and not to clothing of any kind. Each law enforcement agency has different thresholds about when they'll go hands-on with a patient. Every department leader that we have talked to has stated that their directive to their officers is that they will assist us in restraining a patient. If for whatever reason you're on scene of a call and the officers are not willing to help, call the on-duty field supervisor and have them mediate between you and the officers in getting the patient into restraints. The take-home point here is we should never go hands-on with a patient without law enforcement helping us. Maintain a heightened awareness on these calls. If you have an inclination that this call is going to go sideways at any point, work with law enforcement to have them help you get the patient into 4-point restraints. As always, use closed-loop direct communication with those who are applying the restraints, including your partner, and have a clear plan about how you are going to safely restrain that patient. Prior to your departure to the hospital or to CSC, make sure that your ambulance has a clear pathway to an exit, putting all bags and belongings at the head of the gurney. Make sure that the bench seat is flat and sit towards the rear of the ambulance. If at any time the patient begins to successfully get out of the restraints, notify your partner immediately so that they can pull over safely to the side of the road, turning off the ignition and keeping the keys in your possession. Notify the communication center and safely exit the ambulance. At no point should you try to reapply the restraints by yourself. Again, your safety is our primary concern. Thank you for watching this edition of The American Way. Have a safe shift, and thank you for all that you do for our communities.